Hi, Calaveras County. Morgan Gache here with the Calaveras County Chamber of Commerce. And we are in the gorgeous Red Barn Museum here in San Andreas. And it's a pleasure and an honor to be able to stand here with Doug Archer, who is the president and CEO of Mark Twain Medical Center. Doug, thank you so much for joining us.
My pleasure, Morgan.
I wanted to talk to you a little bit about COVID-19 obviously is impacted in your hospital. We had a really delayed reaction to the infection rate. And so I was wondering if you could share a little bit about that process of how you had to ramp up initially and really prepare for COVID-19, but then didn't really have the cases until much later.
We were one of the first counties with positive cases, mainly from the cruise ships. If you remember way back to January, February. So we saw instant activity in a way, but it wasn't real activity. And then we kind of flatlined, we didn't really see too much more. And then the rest of the country and the world was really seeing a lot of activity. And of course we're getting, all these reports of the surge is coming and, by April 1st, you'll be overwhelmed, and that didn't happen. So it was the classic hurry up and wait. And it was, I would never want to go through that again, obviously, but I think it actually benefited us quite a bit because not only did we have a chance to really prepare, so to really get, PPE supplies, work on our cleaning processes and protocols and, how we could segregate patients to keep them safe and staff. But we also got to go to school, so to speak, on the rest of the world and the rest of the country. So it almost felt like it was a wave moving from east to west across our country. And being part of a large organization like Common Spirit Health, Dignity Health, we have facilities in, across the country, Kentucky, some of the, far east, where we could have discussions with them and learn about their challenges before we had to experience it. So I don't think there's really anyone can say the way COVID happened was an advantage. I wouldn't say that. But we were really in a unique position where we could, like I said, go to school on everyone else through real experiences and prepare better for us. It was tough on our staff. And, when you're dressed and ready to go to the party and the party doesn't happen for a few months, we did see some fatigue, we call it COVID fatigue. And, we're doing a lot more kind of laborious processes to do a normal thing. And staff are like, hey, we don't have any COVID. Why are we having to do all this? And it's like, well, we're preparing. So, again, it was almost like a blessing in disguise in a way. We were fortunate not to get hit really hard. And then, of course, when everyone else started to kind of lessen, we started picking up, just recently over the past 6 or 8 weeks. But yeah, interesting experience nonetheless in hospital administration and healthcare and fighting a pandemic. And I think it, like I said, it gave us that time to really prepare and learn from, our brothers and sisters that were dealing with it much earlier on than we were. But everyone thought we were going to be one of the first counties because we had some of the first cases in California. So it goes to show that, we don't really know with the pandemic. It's new for everybody.
With that being said, obviously the mission of your hospital is to serve the community. Yeah. And so my question to you is, how do you balance serving the community through COVID-19 versus also prioritizing your staff and their safety and health as well?
It's a lot of education, really, and it's not always obvious why we do the things we do. And it's perspective is everything, right? So one of the things we've really struggled with is our visitation policy. So, typically when loved ones are in the hospital, you want to visit them, you want to be with them, you want to support them. But in a pandemic situation, that's not a good idea. A, you shouldn't put yourself at risk. And B, we just need kind of, social distancing, all those things. But you explain that to the mom or the dad that's bringing in their, even adult child. That's a tough thing to explain, but generally once they can kind of step back from the situation and hear what you have to say, they get it. But that's probably been one of the toughest ones is obviously for an end-of-life situation, we will let you come visit your loved one. But when you're just dropping someone off or bringing somebody in for a routine colonoscopy, you're not coming in the hospital. That's a tough one. One of the biggest changes that we've seen is how we deliver care. So we had virtually no requests for telemedicine type visits in the past. But after April, when we had really shut down, people started to realize that, hey, I need access to care. I need to get into my doctor. I can't take 2-3 months off. So then we started seeing requests like, hey, can we use telemedicine? And there was a desire on the patient's end to adapt how they do business and how they view transactions and access of care. So that was a big change for our staff as well. The unknown was probably the biggest challenge for our staff. And the toughest thing I think we've had to deal with at the hospital management leadership team level is trying to manage all of the unknowns. So remember, COVID doesn't like heat. So summertime, it's just going to go away. Maybe not. Just all the different ideas and things that people are hearing, and the horror stories we're hearing from Europe and some of the earlier hit countries. The run on PPE. Europe especially had some major, you saw the horror stories of people tying socks around their face instead of a mask. And trying to establish some confidence in our team that, we're okay, we have PPE. We don't think that's going to happen to us. But at the same time, we don't know. We didn't know what the wave was going to be or if it was going to be. It's classic management. It's managing uncertainty, managing ambiguity. Times 1,000. It's a little more intense than just your regular dress code policy discussion or something. But that's been the toughest, is managing people's emotions. And you throw in some fatigue because we've been on high alert forever. And what I keep reminding our team is we don't know what's happening in our employees' lives at home. If you think about it, if you have elderly parents and you visit them and take care of them, there's a high risk there. If you're active, you're going to the grocery store, you're taking kids places and whatnot, and then you go visit your elderly parents, are you bringing them COVID? Are you worried about them because they have other comorbidities or other chronic conditions? So we've dealt with high intensity issues at the hospital. It's a hospital, it happens. But generally it doesn't bleed out into your home, into every aspect of your life. And this one really did. So really helping our team kind of vent and helping them through that, and helping other people understand that, if Betty or John didn't smile and wave at you when they walked down the hall today, don't take it personal. Maybe they're carrying a lot of baggage around today. Maybe they got a lot going on. So just managing all those sensitivities, that's been the biggest challenge. And that's what we really tried to focus on, like little team building events and, pizza day. And our team, the leadership team, we've been trying to get out and around a lot and just be a voice or a sounding board. Let them vent, let them cry. That's the best we've been able to do. That's what we focused on.
What is it that you would like the community to know right now on behalf of Mark Twain Medical Center?
So first and foremost, we're here to take care of you. We've got as of yesterday, 324 people that really do show up every day to try to take care of people and try to do the right thing. I think that's the beauty of our county and with Mark Twain is we are community-based. We're a community hospital. We're the only hospital. So that goes both ways. One is we're here to take care of you, and we're the closest care you have. But at the same time, we really need feedback from the community. So, I'd love to say that we're going to get it right every single time, 100% of the time, but that's just not possible. But what we really need is the feedback, constructive feedback, when we don't get it right. And to be able to call us and reach out to us and say, hey, I was here a couple weeks ago and here's what happened, and I think this could have improved my experience a little bit. So it's cliche, but it's working together. It's giving us that feedback and giving us that opportunity to improve so that next time your experience is better. But I do want everyone to know, we have put a lot of energy into, not just for COVID, but just in general, to be prepared so that we can take care of this community. And we never really know what's going to show up at our front door. Or how many people are going to show up at our front door. So if you can have some patience with us and be willing to give us that feedback and how we can improve, and a lot of times it's just explanation, it's just dialogue. So let us explain why we can't have visitors, Let us explain why you have to wait out in your car to get into the emergency room, Let us kind of talk through those things with you as well. And I think if we work together, we'll be able to provide the better care and a better relationship with the community.
What feeds you? What motivates you to keep going day in and day out? How do you stay level-headed with the pressure of being a leader in this time?
It's funny, but what recharges me or gives me energy is at the end of the day, generally, I go around and I go talk to the team. And when I see, people that are busy, that are engaged in improving the care for our patients, that's what it's all about. I mean, I spend 99% of my time, in meetings and doing things that can be kind of less entertaining, I guess. But what really charges me up is when I go see the staff and I see that they're working on improving processes, on taking better care of people. And then when I get that phone call from a patient that said, hey, I was in your ER last week and I had a great experience. I was at the clinic last week and had a great experience. That's really what does it for me. Because that's what it's all about. Healthcare is about people taking care of people, period. It can be that simple. And I love simple. So when that all happens and that all works, and I know the frontline staff is engaged in making that experience better and the care better, that's really, really all I need.
Doug, thank you so much for joining me and sharing with our business community your heart and the heart of the hospital.
Thank you, Morgan.